Hello everyone, my name is Mindy Vincent and welcome to another episode of Therapeutic Madness. Today, my wonderful guest is my friend and colleague, Jamie Diarte. I'm so grateful. Do I say your last name right?
Yes.
Good, because I love your last name because it rolls off my tongue so smooth.
It does.
Diarte. That's a cool
Ooh,
last name.
yeah.
I know, right? So I'm super excited that she's here today, but we're talking about a subject that isn't like... we probably won't be laughing as much as we usually do, but...
But it's exciting, too, to hear
is.
that you can heal from it, right?
Yes.
That's
So
the
what's
exciting
our...
part.
Tell them what our topic is today. What are we talking about, Jamie?
Should we tell them already?
Should we? Are
Should
you
we?
guys dying to know?
Are you dying?
Da, da, da.
We are talking about trauma and EMDR.
Dun, dun, dun. So I think most people know what trauma is, but we're going to talk about that because I think people misconstrue what causes trauma as well as what constitutes trauma, blah, blah, blah. I think people don't understand the diagnoses either.
Mm-hmm.
So we'll get into that. But tell us about what is EMDR? And
Well,
we'll talk more about EMDR because we want to talk about the trauma, obviously. But, like, when people hear EMDR, they're like, what the hell is that?
Or they're like, oh, that's that stuff that sounds a little kind of...
Voodoo-ish?
Yeah, voodoo-ish. But I was going to say, I cleared a couple traumas for... My son's 21, right? And he works at the police department. And he was actually in a motorcycle accident.
Oh.
And I was... And unfortunately, when your children become adults, you can't make them do what you want them to do.
That is correct. Mine stopped doing what I wanted them to do when they were 9.
Yes, mine's 7. Okay, yeah. But
we're getting worse parents as we get older.
Yes, we're not... My adaptive networking is off.
It's falling apart.
It's falling apart. But I just cleared a couple both of those traumas. And he works at the Salt Lake City jail. And an inmate passed away in front of him, and it kind of, it's the first time he's ever seen anybody die.
Well, I'm glad that he gave a shit, because I've spent a lot of time in the Salt Lake County Jail, and not all guards there give a shit. So, I'm so sorry he didn't see that, and I'm glad that he cared, you know?
Yeah. So obviously people would think, oh my gosh, I understand that a motorcycle wreck is traumatic.
Yeah.
Okay. But not a lot of people think that seeing an inmate pass away would really be that traumatic.
Yeah.
Right? And especially if you have a certain belief system about certain inmates, if they happen to be drug users.
Yeah.
And you have that, well, at least they didn't die on the street, and then you dismiss it.
Right.
But that's not how my son is, right?
Yeah.
Thank God. But,
he can't be. He came from you.
Jamie's
amazing. I love her very much.
I do my best. But nobody would really think too much of that second one being that much of a trauma, right? So when we talk about trauma, old language psychotherapy, that you had big trauma or little trauma, to try and differentiate and not to minimize pain by saying big or little.
Right.
But it was just, the big trauma everybody understood, like anybody in society would understand how that could be a trauma. But there's also, like, some family dynamic stuff, or if you're playing football and you're going in for the running score and it looks like you should make it and you fumble.
Yeah.
And people saying, oh my gosh, we lost because of you.
Yeah.
That can be very disruptive.
Right.
Especially, like, if you're 9 years old, like how 9-year-olds can't make sense of that, right?
Right, and this brings us, so, we might as well touch on this right now. So, like, when you're talking about, like, big trauma, little trauma, oftentimes I hear people talk about trauma, like trauma has to be that you were kept in a dog cage when you were little and abused and burned with cigarettes and all that kind of stuff. But, and yeah, there's no doubt that would be horrifying and traumatic, right? But trauma happens to people for all sorts of reasons, like missing the goal, right? Like, I've been traumatized by catching a really hard edge snowboarding, and like, so then it makes me very hesitant and scared when I am snowboarding, and that's residual trauma.
Yes.
And then if you think about, like, so little kids, when you think about a 3 or 4-year-old, right, and just think about your size as their parent, right? Like, I'm 5'6", when my daughter was 3 or 4, she was like, 38 inches tall or something, And if you can imagine, like, being that small and somebody this big, like, yelling at you and being like, damn it, blah, 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 that traumatizes children. Like, it, and I don't think we talk about that enough. Goodness to fit, parent with parenting is a big, big deal. Like, when people when a parent is a certain way, and you see this too with the generational gaps, right? Like our parents were like, children should be seen, not heard. You know, like you can, I'll give you something to cry about, that kind of stuff, right?
I was just gonna say, you're crying, I'll give you something really to cry about.
Exactly.
Yeah.
And so you see these differences like in generational gaps that also lead to, I think, parents unintentionally being more traumatizing.
Mm-hmm.
You know, and like all those kinds of little things, like when I talk about goodness to fit, like, so I'm very boisterous and loud and blah, 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 right? I'm European. My family, my grandparents all came here right off the boat. So I came from a very loud, like expressive, yelling kind of family. Mm-hmm. But like my daughter, she has a temperament more like her dad's, where she's like more chill and like yelling and stuff kind of freaks her out, you know? And so like we don't entirely have the best goodness to fit as parent and child. And so I have to pay really close attention to how I interact with her so that I don't traumatize her. Because even just the way I interact with my son, who's just like me, has caused her trauma. Like, cause she's like, Mom will get mad.
Overwhelmed.
Yes, yeah. She's just overwhelmed. So yeah, talk to us some more about that kind of stuff too. Like, what do you constitute as trauma? And also, like, when do you feel like it the DSM tells us when it crosses from acute post-stress disorder into PTSD, but the normal people don't know that. So talk to us about some of that stuff.
So sometimes what happens is, like, let's say, let me try and pick an example. There was a woman that stopped at a wreck on I-15, and she gave mouth-to-mouth to a kid.
Oh, God.
Well,
right.
8, 17, you know, and he didn't end up making it. Okay. Well, the effects of that on her after, you know, not being able to sleep, having flashbacks, having nightmares, some hypervigilance, not being able to settle down, being easily startled, not being able to focus on daily tasks, you know.
These are all symptoms of unresolved trauma.
Yes, and it's really how long it lasts. You're just looking at acute trauma versus post-traumatic stress. So long-term, shorter-term, because sometimes our brains can kick in.
Yeah.
And it just takes a while for us to process that.
Yeah.
And for our adaptive information memory networks to link and say, oh, I've dealt with this, seems like this is how we handle it. Yeah. And then it links to that memory network, and it's no longer a problem.
But that's when it linked to a good memory network, right?
Yes.
We'll talk about that.
We'll talk about that. So
in an ideal situation, that is what would happen. But if somebody didn't have good coping skills even from the beginning, though, and didn't know how to manage trauma and had multiple incidences of trauma throughout their life.
We call that complex trauma.
Yeah.
Yeah.
We're going to get into that, too.
That's good stuff right there.
Yeah.
Woo.
It gets crazy.
So, and that's the other thing, you know, single incident trauma versus complex trauma.
Yeah.
Very different in how you handle it. Very different in how many, you know, how much treatment it takes to handle those differently. And if you can do, like, if somebody's had a recent trauma, that clears pretty fast.
Yeah.
Because you don't have a bunch of other situations and experiences linking to that, blocking it up through associations. Yeah,
in EMDR we call that when neurons when they fire together, they wire together. Mm-hmm. And so when someone has... and Jamie might be able to explain this better than me, but when somebody has an incident that happens to them right now that causes like the same feeling or triggers the same negative core belief that previous traumas have triggered, then it links to those memories. And so then when that incident happens again, it's kind of like dominoes. It goes all the way this way and then all the way back, and they have this traumatic response that's triggered from these multiple incidences of trauma that are all linked together. That are informing the brain of how to react.
Yeah, and through that link...
Through fight or flight. Because,
or freeze.
Yeah, or
right?
freeze, yes.
A lot of people do not talk about the freeze.
Yes, and you know, in sexual trauma, like, I mean, I've had a lot of people try to rape me or touch me when I'm sleeping. And I freeze. When that happens, I freeze. So for a long time, I used to sleep on my belly with my legs and my arms like this, and I couldn't have anybody sleeping next to me. But that was a way that I could freeze, and nobody could touch me.
Wow.
Yeah.
Okay.
I had some fucked up people in my early life.
Yeah.
Yeah.
Have we cleared that?
No, actually. I haven't done that in EMDR.
Oh.
I have done EMDR, but... Yeah, it seemed to, like... worked itself out like over time, because for a long time I couldn't sleep next to anybody, not even my son. When I had him, I couldn't have anybody sleeping in a bed by me. But then when I was in treatment at the Haven, my friend Amber, who passed away from an overdose when she was 22, and I loved her very much. But Amber and me used to stay up at night in treatment and just be talking. And one night I fell asleep. She and I fell asleep in the same bed together. And from that moment on, I've been able to sleep next to people.
That is so cool. That's that co-regulation.
Yeah.
Yeah.
Yeah. So that's what.
And that's what people don't understand is, you know, you have self-regulation and you have co-regulation. So you either know how to self-regulate, which sometimes we are never taught that.
Right.
Right? And that's kind of how trauma passes down generations, is kind of that lack of emotional coaching.
Yeah.
Which, who do you blame for that? Do you blame your parents? Do you blame your grandparents? Do you blame your great-grandparents?
Right.
So that's why, you know, a lot of times in trauma work, it's not about blaming. It's just about having better adult understanding, or even working with kids, having a more mature understanding or adaptive understanding of what they're at, what age they are now.
Yeah.
To then, and that kind of just links. You know what I mean?
Right.
And it's amazing, but I got off track now because I was starting to think of kids.
Off track all the time.
All right,
I love
get me
kids.
back
I
on.
never work
Get
with
me
kids
back
because I love them too much.
I know, me too.
I would go home and cry every single day.
I know, people are like, why don't you work with kids much? And I'm like, oh, because it's hard.
Yeah, I had to do an assessment once for a 6-year-old, and he was depressed, and like this little 6-year-old, it'll probably even make me tear up, because this little 6-year-old was like, I just hate myself, and I wish I was dead, and I had to spin around in my chair and just stare at my computer, and I was like, and I turned back around, and I was like, you little man are so amazing and incredible. Like, I just can't handle the pain of like little children.
Oh,
like,
man.
I just want to love them and keep them and then beat the shit out of their parents for not protecting them or loving them right.
That's why I could never work at DCFS.
I can work at DCFS for lots of reasons, which we'll have an entire show about that.
Yes.
But yeah, it's sad.
Right, yeah.
So we don't work with kids that much. We love them.
I love them.
So, but trauma. So tell me. So how does trauma like show itself in people's lives? Because oftentimes, you know how people think that they don't really have any trauma. They're like, oh, I'm not traumatized. You know, like I mean, we talked about this in our episode last week with like veterans. They had no idea that they were suffering from PTSD, and until it like destroyed their lives. And like you and I both work with people in addiction.
Yes, and I work with people just in trauma, and I work with couples also.
Ooh.
Yeah.
That's interesting.
Gotta keep it fresh.
Yeah. Couples trauma work. Shit. That sounds exciting. But so, tell me, so how do you help people understand that it's, like, how do you recognize that it's trauma that is that's taking over the system and running people wild? And then how do you help them realize that?
Yeah. So usually when people come to you, so I do private practice now, and when people come to you, they're hitting something that is interrupting their daily functioning.
Yeah.
Right? And usually people either say, I'm really depressed, or I have anxiety.
Yeah.
And you're like, okay, I can work with that.
Yep. Trauma causes shitloads of anxiety that you don't really know where it's coming from.
Uh-huh. Mm-hmm. Yeah, and so people are like, I don't understand. Like, I just had a lady get a hold of me right when I had my surgery, and I said, it's going to be a couple weeks. Can you hang in there? And she was like, yes. And she sent me already a list of her triggers.
Wow.
Wow, like her boss, different types of authority figures that are all male.
I wonder what that's linked to.
Yeah, right? Or, I mean, there were a couple other things that she put on there, you know, wanting to be able to build boundaries with people and not feel bad or guilty for trying to keep those, you know?
Right.
So, I mean, it can look like all kinds of stuff. It can be intimacy problems. It could be, you know, EMDR doesn't just treat the trauma of single incidents or big disasters or anything like that. It can also treat some of those traumas that happen in family dynamics that cause attachment issues.
Yeah.
Right?
Yeah. Tell us a little bit about what attachment issues are. Because that's important stuff.
Yeah, so that's kind of sometimes what happens when trauma gets passed down generations. Like, I had a client who didn't understand why her mother was so micromanaging, right? Mm-hmm. And she resented her for it, and she felt like she never had any space, and she didn't get along with other women because of that. And, well, what happened was her mother was mothered that way, and it was actually her grandmother that was raped at a very young age.
So she became hypervigilant.
Super hypervigilant, and that 2 generations down,
Yeah.
she can't formulate attachments with anybody.
Yeah.
Because she also grew up in an African American family where it's adult business and kids are to stay to their own.
Yep.
But she wasn't allowed to go anywhere outside the house anyway, so she spent all this time alone.
Oh.
But hearing adult stuff.
Yeah.
And not knowing how to interpret that.
And not being able to ask questions or anything.
Yeah, and not having healthy connections with either of her parents.
Yeah.
And so she is in her mid-30s. If how she describes her sexual relationships is that if she would have had the strength to say no, she would still be a virgin.
Really?
Mm-hmm.
I wonder what made her not have the strength to say no. Is she kind of a people pleaser kind of person?
Absolutely. And that started when she was young and trying to make friends with boys.
Interesting.
Mm-hmm.
See, there's so many things that play into, like, all sorts of outcomes for people, and this is why I tell people when we're talking about clinical work, there are so many things that go into it.
So much.
You know, that you can't put a blanket over any population of people. Like, you just can't. And you can't say what traumatizes, because something that traumatizes one person may not traumatize another.
Correct.
You know, and then some people's traumatic responses are very different. Some people's are very angry. Some people's are depressed. Some people's are very anxious.
Or they run away.
They run away. They flee. Yep. And I've actually seen a lot of people, so this is something with PTSD. People with PTSD tend to re-trigger their own trauma, right? Like, so if somebody they're constantly being hypervigilant, looking for that stimuli that stimulates their PTSD or that triggers their PTSD. So then they're looking for it already so they can be prepared. So they're heightening themselves and then triggering themselves, you know, and so...
Yeah, they have a very overdeveloped sympathetic nervous system.
Yes.
Yeah.
And so that's one of the things that is just like, in my opinion, I think it's just life destroying, you know, when you can't go into a parking lot because you were raped in the back of a car with green interior and you're looking for all the cars with green interior, you know?
Yeah.
It's debilitating.
Yeah. So, that's your nervous system. That's your sympathetic nervous system that is, you know, overstimulated, overdeveloped, and what it's doing is every time that you're in a situation that's uncertain, you're scanning the entire time, and that's exhausting.
Yeah. Super exhausting.
Super exhausting,
Yeah,
right?
and it usually doesn't even get you anywhere either.
Yeah, and how many conversations and how much are people not present during that? Like, how much of their life are they missing?
Yeah. Oh, dude, for sure. So tell us, how does EMDR work? So EMDR is eye movement desensitization and reprocessing.
Yes.
So it was created by Francine Shapiro, who just recently passed away. Rest her soul.
God bless her.
Yes.
If I'm allowed to say that.
Yeah.
I know I can say fuck.
Yeah,
but
so
I don't
you
know
can
if
say
I
God bless you.
Okay, all right, good. Yes. She's in the late 80s. She was a psychologist. She ended up marrying a psychologist. But she came across how eye movements desensitize disruptive thoughts. And she started, you know, using it on people and using it on herself and even just studying it, right? And now we have this beautiful evidence-based trauma therapy that, you know, there's good trauma therapies out there, but why I chose EMDR is because trauma therapy is very hard to talk about, not just for the client. It's hard for clinicians.
Yeah, that's true.
You know, and some trauma therapies out there, you have to go in very descriptive detail.
Yes.
Over and over again. And then you have to listen to your sessions, or you re-listen to things that you might record for yourself. And then you have this homework of going out and doing these things that make you uncomfortable to try and desensitize them. That's rough.
It is. And those are called prolonged exposure and cognitive processing therapies.
I was not going to name them. I was
people should know.
Being nice.
Yeah, people should know. Those are those therapies, and they're often done up at the VA with our veterans. And I can tell you from my experience, I actually, off the top of my head, I can't think of any of my veterans who have started cognitive processing therapy or prolonged exposure who did not relapse as a direct result of those therapies. And
it's
then
re-traumatizing.
It is re-traumatizing. And for somebody who doesn't have a coping skill to manage it, then...
Or a safe
Right. Well, they were in residential treatment at First Step House. And they still would relapse because they just don't have the skills to manage that kind of trauma, and especially not reliving it in that way.
Yeah.
So I haven't always been like a huge fan of prolonged exposure or cognitive processing therapies. It really depends on the trauma that's being processed. But with the kind of traumas that have been processed with me and individual with my veterans, I would never want to see one of my vets like relive that stuff. Like, it's just too painful.
Yeah, well, and this is the thing too, is like I've had like a somebody I worked with in the past, and I stopped by to say hi to her, and her daughter's in college, and I want to know how her daughter was doing. I haven't talked to her for a long time. Like, we text back and forth, but like face-to-face conversation, and her daughter was sexually assaulted by a college student, another college student, 2 of them, and oh my gosh, my heart like sunk. And it had been almost a year, and I asked her, has she seen anybody? What is she doing about it? And she's like, she won't. She will not see anybody about it. She will not talk about it. She didn't even tell me for a month. And I was like, oh my gosh. And I don't know this girl. I just know of her. Just kind of like, you know, this person's pictures and stuff. And so, but she knows of me. Yeah. And I just said, why don't you ask her if she'll talk to me? Have her watch this. I had her watch a video on EMDR and read a certain thing about it. And I said, you know, she's not going to have to tell me much detail about it. Yeah. How good is that for clinicians, and how good is that for the client, right?
I know. How like, calming must that be? Like, you don't have to tell me all the details about it. And they're just, you actually don't have to tell me shit.
And they're like, I don't? And I'm like, no, you just have to give me a couple words just so I can bring it up. Yep. And they're like, wow. And then, you know, they might tell you some stuff during the reprocessing, and sometimes some of that stuff is hard, but not having to hear the whole story.
It's not the same as like writing it out and then re-listening to it and doing that over and over again.
Yeah.
Right.
And so even, you know, and I don't speak for EMDR, I don't speak for the Institute or the International Association or anything like that.
Yes, you do. No? Just kidding.
All the good parts are from them.
All the good parts.
But as a clinician, I did not want, you know, I have a family at home too, right? Yeah. And I'm pretty good at taking care of myself. I mean, I don't know if you can tell right now, but I go to the gym, you know. But it is very hard for clinicians, you know, and so I said, okay. And I, you know, got trained in EMDR, and I have a great mentor, and I just see the change, and it's like, it's literally like the person in front of you, and by the end of it, they're like, I feel like I just lost 50 pounds. Yeah. And they're excited, and they're pronking, and they're, you know, having a good old time after, or they could be tired, just everybody reacts to it differently, you know what I mean? But for them to have that release of that disruptive memory is just, one, I feel better about being a clinician. Yeah. Let alone, I don't know, I mean, in private practice, people are coming and they're seeing me and they're spending time and they're seeking it on their own and stuff like that, but like for a government agency, right? Mm-hmm. I know more and more government agencies, and I'm going to be speaking with one next Friday about EMDR, but they're not always there because they want to be there. Mm-hmm. So if you give them a therapy and you're trying to help them with their trauma, because all of us know the majority of the time we're violent, or we sexually act out, or we use drugs as a coping skill. Yeah. Right? Yeah. That's a terrible coping skill.
All 3 are not great coping
right?
skills. Yeah,
right? So usually there's trauma or disturbing events or memories that are feeding whatever we feel like we need to get out of us. Yeah. And so we take drugs or gamble, or
we're just seeking relief.
Yeah, we're trying to regulate ourselves.
Yep. In the best way that we know how.
We don't like this much pain. Well, the opposite of pain is pleasure.
Correct.
But, you know, in therapy we work on that black or white, right? Somewhere in between. Yeah. But we all know that's just a way of trying to regulate ourselves, and, you know, that sucks. Yeah. To be stuck in that.
And to
Just-
not even know that that's... So
Why?
oftentimes people don't know what they're stuck in, why they're stuck there, and they certainly don't know how to get themselves out.
Yeah, absolutely. So
But we have answers for them.
yeah, just like the last podcast, you were talking to them about saving lives and helping drug addicts, and it's not just about getting rid of disease or keeping them alive. The next step is offering them a life.
Yeah. A life beyond their wildest dreams.
Oh, yes. Yeah.
I love that.
Dude, it's so good, right?
Because it's not enough just to do the minimal. You know, people, especially those of us who are providers, like, they deserve so much more than that from us.
Right. Pain relief.
Exactly. So, okay, well, we're going to take a really quick break, and we're going to come right back, and we're going to talk more about EMDR, the reasons why I love EMDR, why Jamie loves EMDR, how it even works, and we will see you in just a minute.
Peace.
Hello, everybody, and welcome back to Therapeutic Madness. I am Mindy Vincent, and guess who made it today? My co-host, Mr. Justin Areola. We're so happy to have him joining us.
Wow.
The infamous.
Oh, yeah.
The infamous Justin Areola has made
That's
it.
right.
He's
I am
so
in the
sad
building
he
now.
missed the last episode.
I am sad I missed the last episode.
Tell our friends at Utah Naloxone you missed them.
I miss you.
Isn't he the
Jen.
best?
I miss you, Jen.
She left all of her credentials here. I had to chase her down the road waving them, and she drove away.
Like her badge.
Yeah, but she came back for it. So
Good.
we were talking with Jamie. Justin was peering back there, so he knows what we were talking
I was
about.
creeping on you guys.
I was going
Yeah.
to say you're being a creeper.
That's
right? Spying like a voyeur.
Yeah.
That's right.
So we were just talking about EMDR and
Yeah.
trauma, and we were talking about how, you know, trauma is different for all people. It shows itself differently. It interrupts life differently.
Mm-hmm.
We were talking about some treatments for EMD or for trauma that we're not necessarily huge fans of per se. So we're going to talk about EMDR and what that is.
Yeah.
And I'll say, first of all, one of the things I love about EMDR when I got trained in EMDR is I found that all the other things I've been using therapeutically to help people all these years with dealing with distress were really like Band-Aids. They were coping skills, right? They were like, here's a skill to manage this anxiety that you will live with for time and all eternity. Right? Where EMDR, where EMDR comes in and swoops it out. Like, it cleans it out is what it reminds me of. Like, it heals the wound instead of putting a bandage over it.
You know what it's like?
What?
It's like, you're like,
No, but
dun,
tell
dun,
me.
dun, dun,
Jamie and I have
dun.
already been doing drum rolls and
we're-
everything
yeah,
this
we're on it.
today.
Nice.
We're getting
So it's
crazy.
like, your body is amazing, right?
Thank you.
I mean,
She's been working on
It's true.
I mean,
it.
I love these guys.
the body is amazing. And
All of your bodies.
Yes, everybody's body is amazing. But it's just like, there's no difference if, like, say I was a framer and I got a nail in my leg. And it was so traumatizing to me to have this nail in my leg that I didn't want the doctor to pull the nail. I didn't want the nail to be addressed. I just wanted the pain and the blood to be cleaned up around it.
Yeah.
Okay? Because the nail is causing the pain and blood. So, clean up the symptoms, but don't remove the nail.
Yeah.
Well, what's going to happen if we don't remove the nail?
Just gonna keep fighting that thing.
And it's going to get worse.
And you're going to get lockjaw
And
because
it's-
you're going to get tinnitus.
Thanks, Mom.
Oh, wait, not tinnitus. What is it called when people get tetanus?
Yeah.
Tinnitus.
So I'm not a
You're gonna get some
doctor.
ear
Tinnitus
ringing.
is the ear
Yeah,
ringing.
that's gonna be ear
Yeah,
ringing.
I know.
Okay.
And that's why
Tetanus.
as soon as I said, I was like, wait a minute. Tinnitus is the ringing in the ear. So. That probably is not going to happen from a nail.
You might.
Maybe.
You never know.
You
You never know.
You're right. I'm not a
Okay.
doctor. We should have asked Dr. Plum.
Yeah. But anyways, those symptoms are going to keep coming back or getting worse.
Or getting worse.
Right? Or even if the doctor can get it really quiet down, the first time I walk by this table and I bump it, it's going to start all over again, right?
Yeah.
Like, that was almost like trauma being triggered, right?
Yeah, absolutely.
The body, guess what? The body will heal if you remove the nail.
Yeah.
What an amazing concept.
But the body also remembers trauma.
Yes. So every time I get around the nail gun, I'll be like, hey. But the brain is the same way. If we have a wound in the brain and we can't heal it because it's looping, right?
Yeah.
Those are the symptoms.
Yeah.
All, the anxiety, the heart palpitations, the inability to concentrate, the hypervigilance of survey, like those are all the symptoms of the problem. The problem is that event, and the brain hasn't made sense of it. It hasn't filed it to solve this problem with other memory networking, and so it doesn't know how to resolve it, and so it's just going to continue to loop until we pull the nail out.
That's funny that you talk about that specifically from a veteran standpoint. I am a vet. When you talk about like hypervigilance and some of those responses, like that's kind of beat into you from the time that you start going through training. Right?
Yeah.
Just be on point, be on point. And so then when you have this traumatic experience, but you're also taught to like embrace all of that hypervigilance and use all these survival skills, it's like a problem times 10, right? So
yeah.
anytime you walk into a room, you're looking at everybody, you're assessing the room, and that kind of triggers you. I mean, that's why you see a lot of these vets can't leave their houses, because you're just constantly in that mode.
Yep.
Or they go into fight mode.
Right.
So much.
Oh my gosh.
Absolutely.
Yep.
Yeah.
Yeah.
Vets
right?
can get very angry.
And
I love you guys.
Yeah. And it's because.
Shout out to my vets.
Yes,
yeah. I love my vets even when they get mad. But I'll tell you what, vets get mad as shit about like crumbs on fucking counters and shit like that.
Yeah. I actually work with a lot of. I actually work with a lot of military from Hill Air Force. So I have a couple Army people too. Yeah.
Love that.
And I just had a couple people that retired, and so I had to go through the Tri-West stuff and get on their stuff. But yeah. So, anyways, but yes.
Tri-West.
Terrible.
I know everybody had heart palpitations when I said that.
Right, oh my god.
So sorry.
Yeah.
But, so anyway.
So yeah, EMDR is very exciting from I mean, you've kind of talked to me a little bit about EMDR and breaking that trauma loop in your brain and doing some of that. I still haven't done the EMDR. I'm not sure I'm ready to go into that. But
all you got to do is find somebody that's cool and that you feel like, you know, like that person could be my person and take that journey with me.
Yeah.
Justin, have you met Jamie?
I just like to leave the bones buried, man. Just buried in back.
So funny. What happens when we leave bones buried, Jamie? What happens when we ignore trauma? Which, by the way, trauma doesn't just start when you get to basic training. It starts usually in childhood by acquiring, like for me, when I was little, I had things happen in my life that told me that I'm just not good enough. You know, that for one reason or another, people will always leave me when I need them most. And that has been a reoccurring, like, I think sometimes it becomes a self-fulfilling prophecy in my life.
Absolutely.
And then
you get used to it.
Yeah, and then also it created my my self-defeating behavior, which is inability to trust. So like I cut people out of my life before they can cut me out, before they can even come close to even thinking about doing something shady to me. It's like, bye, bitch, you're cut out. You know, and that's my trauma responses. That came from when I was 6 years old. I know exactly where that came from.
Yeah.
You know, so.
So you just asked him an interesting question.
Yeah. Which was it? What was it?
What he has done about it. No, what has he done about it?
Oh, I go to my therapist.
I know.
Oh, yeah, I do EMDR around it. But this is how I learned that. Like, so this is how I learned all the skills. Because I've been to treatment, like I've been to residential treatment like 2 years out of my life. Because I went through the House of Hope, I went through the Haven, been to uni, Win, Benchmark. Like, shout out to all of them. Thank you for taking my shoelaces as a juvenile. I know, like, anyway, so. I thought that I had learned all these skills because I'd gone through treatment and I knew all these skills, right? But then when I went to do my EMDR training, you know how they have you pick something that's like really minor, whatever, right? I can't even remember what the hell I picked. But like within 3 memories, it went back to my mom leaving when I was little. Yeah. And it was like, what the hell? Because I have processed so much about that in treatment, you know, and read all the doctor's letters and all that kind of stuff like you do in the Haven. And I've cried and slung snot with all my, you know, my little friends in treatment, and like, and you know what, it didn't heal it. No. It just made it livable. And when I did the EMDR around it, that's when it finally started to heal. But then there's other things that can trigger the same belief, but they're different instances. You know what I mean? It's kind of like the same weed growing up, but it looks different.
Yeah, you go right back there.
And so tell us how EMDR works.
Yeah. So
and why Justin should start doing it right away.
Where are we going to start doing EMDR? That's what I want.
Yeah. Let's do it on Justin on the show.
If it was a recent single episode thing, then I would do it.
Look at her being all protective of you. Justin's like, don't you fucking dare.
See?
But,
I know. Jamie's the best.
Oh.
She is the best. I'm so happy you're here today.
I'm so happy to be here with you. It's been way too long.
It has been way too long.
Like, way too long.
Yeah. She's one of the coolest clinicians ever. I love her.
So,
Ian. And an old school harm reductionist. This is how I know Mark Bigler. This is how we end up with him on the board.
Oh, Guess who else has the same birthday as me? Mark Bigler.
What? Happy birthday, Mark Bigler, on February 19th.
Yeah.
Which passed.
Isn't that weird? Like, like he was my
Right?
mentor, and she
Your
has the
EMDR
same
mentor.
Yeah, she has the same birthday as me.
It's the
So
universe.
it's a
And your
trip.
Aquariuses.
We're a cusp.
You're on the cusp of Aquarius and what? What's after
Pisces,
Aquarius?
Pisces.
Pisces.
Mm-hmm.
That one's in
Right on
Aquarius.
the end.
My son's in here.
Sweet. That's why him and I are gonna get along so well,
Yeah.
right?
Yes. You're a Scorpio. My daughter's here too.
So cute. Dude, you make
She's
good
like, don't
babies.
forget my sign.
But okay, so what happens is when we have these events that happen, which
Right.
again we've already kind of discussed, like how the array can go.
Right. And the neurons that fire together wire together. Yeah.
But what happens is when we have these events, our brain gets overwhelmed and it can't make sense of it, right?
Yeah.
And that's traumatic for us. It's very disruptive.
And for our friends that we call and yell at.
Yeah, right? Or do other things too. But so what we need to do is give the brain a chance to reprocess that
Yeah.
in a safe environment with somebody that's safe.
How do we do that, Jamie?
Oh, it's so amazing. But
Only people like me and Jamie and Justin would talk about trauma in these strange ways, huh?
yes. Let's dig
Justin's like,
into
what
it.
did I walk into in here?
Okay, so what happens is then that event starts linking up with other things through association. Feels like, seems like, looks like, must be like.
Yeah.
You know what I mean? And then that's how the past bleeds over into the present. And we're like, that really wasn't a big deal. It was like level importance 3. Why did I give it a 10 reaction? I overreacted. Like, I don't understand. Well, it's taking feels like, seems like, must be like from the past.
So I'm reacting to all of that stuff.
Yes, you're being informed by the past of
Yeah.
how to react today, right? And so it just bleeds over.
Okay.
And then it starts hurting our relationships, our careers, our
Do you want me to just lay down
life.
on the couch over here?
No, you don't even
You have to sit up for EMDR.
Yeah.
Oh, cool.
Yeah, because it's like this.
Or tapping.
Or tapping, or you can do it with sound. I do it with sound because my arm gets tired. Because I'm lazy as fuck. Actually, I'm not, but like my arm does get tired
It
when
does
I'm
get
doing
tired.
it.
Yeah.
And so
Or you can
I
use
use
light
sound.
bar. You can use
Yeah,
light
I want to
bars.
buy a light bar. I like $600.
Or more.
So it sounds
Or more.
pretty Fancy.
Yeah.
Yeah.
They have like an app on the phone, but I don't understand it. So
Yeah, and then they have like a lap board, and I don't hear very good stuff about that. Like you can actually put it in
interesting.
your
What I'd
lap.
like to get is a little shocker, one that goes. Zzz, zzz, zzz.
Oh, I have those. The pulsators. Yeah.
I think that'd be funny, kind of.
I don't want to say what it looks like though.
Let's make like a light
That's
mask or
hilarious.
something.
That
Yeah,
makes you
to
want to bring
double.
on Tripp's thing over there. But
Yeah.
anyway, we'll show you that after.
Yeah. Okay. Anyways, but so what EMDR does is it's that bilateral stimulation that lets not just the logical side of the brain, but also the emotional side of the brain.
Yeah.
Right. And
That's
so
some DBT shit.
yeah, so it brings it together to make sense of it emotionally and logically, and then lets it attach to a memory network that it needs to go with. It's almost like storing a file, like a computer. Zzz, goes
Yeah.
over there. And it's like, oh, okay. And it desensitizes and takes care of not just how you think about it or what images come up, but it takes care of body sensations, so you
Mhm.
don't feel like it.
Yeah.
Because in cognitive behavioral kind of stuff, like you can switch the logical side and think differently about something, but it doesn't mean you feel differently.
Not
about something.
always. Not always. Because, like, that, yeah, you're right.
You gotta
because
feel it to heal it.
in CBT, we always talk about change your thoughts, change your feelings. But you know what? There's lots of times, like, and I talked to Justin about this, where I change my thoughts about something, but it doesn't change the way I feel. And I know that it's a traumatic reaction that I'm having, but it hurts me the same.
Yeah.
You know? And I
Yeah.
can't make it just stop.
Yeah, and it's how you're
Luckily for me, I have enough
trained.
insight to know that when
Yeah.
I'm having traumatic reactions, maybe not right in the moment, so then I end up having to make a phone call and apologize. But
Yeah, repairs are important.
yeah.
The good thing is that you know how to do them.
Well, and that's the good thing is that too that I can recognize trauma in my life where a lot of people cannot. You know, and a lot of people, there's so much stigma around trauma, and I think that we've also made things like so soft and like, you know, everything for everybody that people don't even dare to say like I'm traumatized because they don't want to be that little softy biatch. You know what I mean?
Mm-hmm.
Well, particularly for men, especially in like in my family.
Yeah.
You know, the men are supposed to be, you're supposed to be the strong male. You're supposed to be able to handle everything. You know, don't be a pussy.
Yep.
Man up. Like, these are things that you hear all the time, right?
Yep. I've said them to my son.
Suck it up, walk it off, those kind of things.
Yep.
And so you become very efficient at just disassociating yourself with whatever that is and just putting it away or burying it. I mean, I've had some, episodes in my life where I've drank or had to deal with things in a negative way that I didn't really understand why I was acting that way per se.
Yeah.
And now listening to you guys, it's like, oh, well, maybe, yeah. There's some stuff there that, I mean, I'm perfect now.
Yeah.
Yeah, I see that.
He's great.
I'm well put together now, but.
Yeah. He's got it all together.
Yeah.
Which is why he's starting EMDR with Jamie next week. Should private practice in Ogden, like when you're heading out to the mine, you can stop and see
There you
Jamie.
go.
Yeah. Well, I'm actually in Clearfield. My office is, but I live.
Close enough.
Yeah, close enough.
Close enough.
But so what happens
like,
is
shut the fuck up.
yeah. So it's desensitizing. It's not just, again, thoughts, images. It's everything. It's the whole body.
Yeah.
And you're not finished with a targeted memory or event until the whole body agrees that it's finished.
Yes, because
Yeah.
I was. Go ahead. Justin.
So when you're doing these things, so let me see if I kind of understand
Okay.
this. So you trigger the memory,
Mm-hmm.
and then you disassociate the pain of the memory.
Not disassociate.
Desensitize.
That's what we're trying.
Desensitize.
Yeah, we're trying to avoid
Okay, sorry.
dissociation.
And in fact,
Wrong
when
word.
people dissociate, that is actually something we have to address in EMDR
Uh-huh.
because that is often what people do, like especially someone with borderline personality disorder or borderline personality disorder is often misdiagnosed as like complex trauma is misdiagnosed as borderline. Often. And so so we see people dissociate, and they just kind of check out. Have you seen where people are like or even in a group, right? You see it in group therapy all the time. People are just like,
Yeah.
and it's because it's just too much, and so they just check the fuck out.
Yeah.
And but we don't want people to do that in EMDR.
No, we don't want them to do that in EMDR.
And it's actually, it's something we have to correct when they do.
Okay.
So,
So you
But you
give me this.
desensitize.
Like we go into
Yeah.
this memory,
Uh-huh.
and then what is the stimulus? Like.
So,
how does that
if
work?
it's tappers or if it's eye movement or it could be sound, I typically do eye movement or tappers.
Okay.
They're just pulsators that go back and forth, and you can either hold them in your hand or you can like stick them under your legs.
Okay.
Or tapping. I can use my hands and tap.
Okay.
it's
And
any bilateral stimulation.
any
meaning
bilateral
it stimulates one
stimulation.
side of the body and then the other. So.
Yeah, and so it's getting that left and right side of the brain to reprocess that event in a safe environment instead of feeling unsafe back then.
Okay.
And so you have that dual awareness that I'm just visiting,
Yes.
but I'm okay.
Yes, because it's one of the things about EMDR is you have one foot in yesterday and one foot in today. Like
Yes.
that's like one of the goals of EMDR is we don't want people to be living in the past. We want them because it's a past event that's affecting them today. So we
Uh-huh.
want them in both places at once.
Yes.
Yeah.
So the idea is that you're creating new neural connections, or you're
Yes,
unwiring that trauma.
you're
to
taking this single memory network that is looping and you can't get rid of, and you have in your brain already generally an idea of solving this,
Okay.
but it just gets overwhelmed and doesn't get connected.
Okay.
So it's
That
over
makes
here
sense.
trying to figure out how to resolve the problem, causing symptoms.
Right.
And so if we take care of the problem and give your brain a chance to reprocess that and your body to go through the body sensations and the feelings to pass
Okay.
and the images to pass, then the body can make sense, or the brain can make sense of it. And it's almost just like filing it with this other memory network over here, and then you're like, oh, I'm okay.
Yeah.
Cool.
Today I'm okay, you know?
Yeah. And in EMDR, so like,
That's awesome.
I want to kind of explain how this works. So like, people think that they come in and they're like, oh, I had this trauma when I was 7, and so let's do EMDR on it. But that's not how it works. Like you look at the symptoms that it's causing today, and then that's where you take, like for me when I was training on EMDR, I remember what the memory was, or the thing I picked. It was having anxiety driving in Los Angeles. You know, so then what you do is you take that, you know, like they started with, okay, so you're driving in LA, you have this anxiety, blah, blah, right? And then we do a float back. And it pulls up these memories. You know, we'll think back to a time when you may have felt that way before and see what comes to mind. And that's when within like 3 memories, my mom leaving me when I was 6 is what came up, you know?
Yeah.
And it was informing my anxiety in driving in Los Angeles, right? So then we start with the desensitization, which is like the eye movement or the bilateral stimulation. And then we reprocess it. The next step after that, when people don't have any more like physiological sensations or anything about it,
Or any other memories coming up.
right, then we reattach it to a new positive cognition. Like, I am worthy, I'm good enough, I'm capable, whatever it might be.
I'm safe.
I'm safe.
I can protect myself now.
Do you find that a lot of people hate the words? You know how in the beginning you teach them calm and safe place?
I never say safe place because they hate
I don't
it.
either because everybody hates it. And then I wonder if by like the end, you know, like the thing they're working on is I am safe. And it's like, wow, I remember at the beginning we couldn't even create you a safe place hypothetically in your mind.
Uh-huh.
Yeah. It's
Craziness.
really interesting.
But yeah, it's...
That's cool.
Mm-hmm.
Yeah. And then after that, you go through the body scan, you know? And
make
so,
sure the whole body agrees
yeah,
that it's good to go.
Yep. I love it. So what's your favorite thing about EMDR and how do you find that EMDR is most effective? Like, is there anything that ruins EMDR, do you think? Are there people who are not good candidates for EMDR?
Yes. I mean, if you have some medical problems, you know what I mean? Like,
I'm sorry, I will keep my hilarious jokes to myself because they are inappropriate, but immediately my mind made a lot of funny jokes.
I bet it did.
Yeah.
And mine might have.
I know, right? Me and Jamie are like, we are inappropriate therapists, but
we're fun.
We are fun.
And trustworthy.
That's right.
And loyal.
Boom. And people love us.
Yes.
And we're cute.
Agreed.
Anyway. Oh, hey, we got a thumbs up.
And so is he.
Agree with all of that.
But, I don't think... Does anything in EMDR? I will say, like, recent protocol, like, so recent trauma exposure, things that have happened in the last year.
Yeah.
I can clear that all day long. That, to me, what's harder for me are the attachment ones.
Yeah.
That whole family, because they're so interwoven and
With
there's so many much
things.
When you say attachment, what do you mean?
Oh, we're talking like childhood trauma stuff, and so how like generational trauma gets passed down, and people get trained, and their nervous systems get trained, and so, you know, it's always this phenomenon, and it's still like I can see it, but it's still crazy to think. Generally, like if we do not become aware of our issues, we end up becoming our issues
and passing them on.
And what I mean by this is, when somebody comes to me and they say, I hate my father so much, and I don't know how I ended up like him.
Yeah. Okay.
And I'm like, whoa. Ugh, attachment issues.
You're like, shit. Shit. Attachment issues cause a lot of problems, though.
Yeah,
for
they
people
do.
in life. Like, yep, exactly. Pack 2 lunches.
Pack 2 lunches. Cool.
Yeah.
So who do you think are not good candidates then for
if
EMDR?
you have people that have stroke problems, anything brain functioning problems. Like I had a lady that had some eye problems. That's when you just switch to a different modality. Like you do tapping instead.
I actually got trained with a blind person.
Really?
Yeah, I was like, so you can imagine how many times I was like going to be like, hey, no, and it wasn't working.
No, you didn't.
She was super cool, and she had a seeing eye dog, so I was wondering if I could just do it with him, But,
I don't think that will take care of her.
But yeah, I guess it didn't work out. So, but it did work just as well with like the tapping, because I had to do hers with tapping, obviously.
Yeah.
Sorry, I could not keep myself from making that joke. It's a true story too. It was in Colorado.
I believe you.
Now everybody will know who it was.
Oh no.
There's
only
there's
one
a lot of
blind
providers.
person.
Well, probably no.
No.
One blind provider in all of Colorado. So anyway, people with medical problems maybe aren't good candidates for EMDR. But what do you say to people who, like, are afraid to do EMDR? Like, what would you say to Justin if he was like?
Let's start with the fear of doing it.
Ooh.
Yeah, and probably my immediate shot back would be like, I'm not afraid of that. It's just, you know what I mean? Like, I would say something like that, like, I'm not really afraid of that. I just, maybe I feel like I'm in a good place right now.
Yeah.
Or I just don't want to
mess anything up.
I just don't want to go back there because it's like, you pick at a scab, right? And then it starts bleeding, and then all of a sudden you've got this mess.
Because there was a fucking nail in your hand, Justin.
Right, but it's all healed up and it doesn't bleed anymore. You know what I mean? And so getting through some of those processes where it's like, now at this point, and I've done some of this like even with my relationship stuff, but I also, my mom left when I was an early age. I was raised by my grandparents, and there was always trauma around some of that. I really wanted to be with my mom. I couldn't figure those things out. And I've worked through a lot of those, and maybe not necessarily EMDR, but I do find ways to like change my thoughts around it, right? Put myself in her shoes, practicing radical forgiveness, being thankful for the things I have now, understanding that some of that did affect me, but I feel good about where I'm at now, and so that's part of my journey. So what do you say, like, how would you encourage somebody to take a look at EMDR who may be a little resistant? You know, if you knew somebody who was like sitting next to you right now that was a little resistant to EMDR, what would you say to them?
Had a story similar to Justin's. What would you
that had
say?
some, you know, something like that.
What would you say?
What would you say to that person?
I don't ever make anybody do EMDR if they don't want to. I'm just a therapist. I'm a clinician. I can, you know, generally most of my clients end up doing it. You know what I mean? It took like.
I'll get you.
Well, it's actually like
I
the
will get
easiest
you.
therapy to do because
It
you
is.
don't have to sit and talk about all the old stuff. You don't have to like try to figure it out in your brain.
But it
and
doesn't mean that
process
there's
through it
not a
endlessly.
therapy. I mean, it's
Yeah.
a part of therapy,
Right.
right? Like,
So there's just a recipe.
not
to help
every
somebody.
time do you do
Right.
bilateral stimulation reprocessing.
Right.
Because there'll be times where you are okay, and then you're looking at relationships, and you're looking, you know, how careers are going and work and managing stress, and how are you doing it taking care of yourself along with taking care of others. Like, how are you managing that stuff as a part of treatment?
Yeah.
But when a trigger comes up,
That's when you should look at it.
like, my girlfriend was over at my house, and we fought over, because I burnt the pizza.
Yeah.
Doritos.
And it's a 2, and I gave it a 10.
Yeah.
And it's like, interesting.
Yeah.
Let's take a look at that and see where that goes.
Yeah.
That's the scary part. When she goes, interesting, with that like very knowing smile, like.
No, I don't say it that way.
What's the best thing about it though is like, so I relate to you so much when, you know, like changing your thoughts about things, learning these other skills, like putting yourself, you know, like putting myself in my mom's place. Like I've long forgiven my mom. You know, I love her. I've made mistakes as a mom myself, right? And I thought that like all those things had like truly healed it. And it took until I was doing EMDR before I found out that like I really was living with an open wound.
You were holding on to that.
Mm-hmm.
Yeah,
I was
yeah.
living with an open wound that I thought that was healed. You know, because the bottom line is that as an adult, you can change your mind about things all you want and change the way you reason about it. But 9-year-old you doesn't have that mental capability, period.
Yeah.
Didn't then, doesn't now. And when you're still trying to heal something from when you're a child, it's not possible for your adult mind to heal it. Because, like, not having that presence and then all the other things that go along with it and wondering, like, children don't have the capacity to look outside of them either and be like, oh, well, my dad's not here, it must be because of him, you know. Children are like, what's wrong with me that my dad doesn't want to be here? What's wrong with me that my mom's not here for me?
Yeah.
You know, and so it's, when people are like, oh, I've just changed the way I look at it, like, well, that's just not even possible because children don't have that capability and that happened to you as a child, not as an adult.
You try very hard to, like, be perfect or do all these things so that maybe they'll come back around.
Yes. Yeah.
So I'm not saying everybody that has a traumatic past has to do EMDR to have a good life. We can learn how to manage all these symptoms, and we can have 2 or 3 either self-regulation or co-regulation skills, which self-regulation is we learn how to regulate ourselves and take us from, like, say if we're going fight or flight and we're not okay and our nervous system's all activated, how to calm it down and get more into the green where we can connect and problem solve and be creative. And then co-regulation is if we're not doing well at that, then we go to a friend. You know, if like I'm having a bad day and I call Mindy and I say, hey, I just got to get in my head for a minute, like, and then she tells me about her day and I'm like, oh, I feel better. Like, that's awesome. And then I'm past that unpleasant part of it, right? But it doesn't mean I resolved whatever was going on. I just distracted myself.
Yes.
Right?
Yep.
So
Fixing other people's problems is generally
a good distraction, yes.
Mechanism for me.
But it doesn't mean that that problem's taken care of. Kind of like, so.
Sure does.
And everybody
Feeling
has
fine.
some trauma, right?
Yeah.
I might have a backpack that's 20 pounds extra heavy. You might have one that's 100 pounds
Couple
extra.
pounds, like 1 or 2
You know,
pounds.
Mindy might have one that's 50 or whatever,
Yeah,
right?
yeah.
But
I like that hers was the lightest.
Yes.
Backpacks.
well, I just had surgery,
Oh,
so
nice.
I have to have a light backpack. I
Nice.
don't want my doctor
Right.
watching.
She
true.
can't carry
That's
more
true.
than a gallon of milk at a
Yeah,
time.
that's right.
That's
So,
nice.
but
We're trying to keep her safe.
what happens is, my backpack that's a little lighter, I might only need to train my body to handle that backpack a couple times a week.
Okay.
She might have to do it 4 or 5 times a week. You might have to train yourself using all those skills and keeping yourself strong
Yeah.
7 days a week.
Once or
Well,
twice in my lifetime.
no, but you know what I'm saying? So, but how much time,
Yes, I do.
how
Oh, how
much
well put together
time
he is.
does that take?
Yeah.
And does,
And energy.
Does it distract from
Yeah.
the things that you really need to get done? Like sometimes you get stuck on this thought pattern of like the most random, ridiculous stuff. Like, you know, 10-year-old me is still feeling guilty over something that's like so inconsequential.
mm-hmm.
So inconsequential now, and you're still kind of think about it and you're like, what am I doing?
Yeah.
Like, why am I even thinking about this right now?
And suffering, you know, when people say suffering is optional, it truly is, because we have methods and availabilities to help people not suffer. And I wish people would understand that they don't need to suffer. You know, like to be like, oh, well, I'm fine, it's good, like I don't need to look at this. Like that is people, you know, carrying on their own suffering, and it's just not necessary. And if people understood how easy EMDR can be, and also how quick it is, so that's another thing that's important to talk about.
Yeah.
EMDR. EMDR is a very fast therapy, where if you were doing like psychotherapy, like Freudian kind of psychotherapy, right, you would be looking at being on the couch for like 3 years.
Or longer.
Or longer. 3 years is the beginning. So, in EMDR, typically
It depends where
it
they're
depends
coming
on
with.
where, it depends
Yeah.
on how much trauma they have and such, but it is not a long therapy. Like, I can get through, like, a thought thing in one session.
Yeah, targeted memory.
Yeah,
Mhm.
targeted memory. And maybe, in, like, usually a few of them. Because there's a whole bunch that are tied to, like, one piece.
Oh, yeah, the little associated memories
Yeah,
that go along
and you'll
with
see
it.
some drop off, like, while you target these ones, and it'll kill
Mhm.
other ones and whatever, but...
Kill.
So maybe this is an exciting, you know, way of helping people deal with some things in a different way, because there is a really big stigma around even asking for help with mental health, right?
Mhm.
Yes.
And nobody wants to be labeled crazy. If you're going to a therapist, there's something really wrong with you. Like,
Right.
you know, there's all these things that are associated with that. And so maybe doing the EMDR, like, I definitely don't want to sit on a couch for 3 years.
Yeah.
And I wouldn't even start to work on something if I knew it was going to take me that long.
Right.
And so this is exciting to hear you guys talking about like the shorter treatment
But so
modalities and some of that stuff.
that was kind of a
That's cool.
long kind of explanation to really sum up that if somebody wasn't so keen on it and they didn't know how they felt about it, then what you do is you teach some management stuff, but when things continue the way that they've been continuing and they're just still not that happy, eventually curiosity about change happens.
Right.
Yeah.
So you're
Right.
planting seeds.
Yeah, maybe I'm planting little seeds along the way. But, you know.
And I love to remind people, too, that they have already lived through the traumas that they've experienced. Because that's when people are resistant and hesitant to take a look at trauma, it's usually because they're afraid of reliving the trauma.
Mm-hmm.
And I think it is important for people to know that EMDR isn't painful like that. Like, it's, I explain to my clients that it's like being in a train going through a tunnel and you're just watching all the things go by on the screen, that you've already lived through them, they've already happened, you know, and now we're just clearing them out, you know. So that is often helpful for people too, because they're afraid of reliving the trauma.
And the other thing people get really locked up about sometimes, especially if you kind of have like an avoidant attachment style, is they get really worried about being able to describe how they feel.
Yeah.
Because they don't know how to name feelings or body sensations.
Yes.
Or even
You
just
don't
talking
need
about
to.
it.
You
Yeah.
don't
Talking
need
about your
to.
feelings. Like,
Somebody just, I just
I don't
say,
want to talk about my feelings.
just notice
man.
where you might be feeling something. Just notice kind of the emotions that might be coming up. And just stay with it. Just
That's
lean
cool.
into it a little bit and let them pass. And then the bilateral stimulation lets all that clear through because the brain's processing it.
And it's a trip too. So that's the other thing is bilateral stimulation. Like, this is why that it works. Is it does the same thing that happens to the brain in REM sleep when your eyes are going back and forth. So it processes through these things like lightning fast in comparison to when you're just sitting there in talk therapy. Like, it's literally processing at the speed in which you're talking. Right, where in EMDR, it's like, and it's just processing on its own. It's really weird. I mean, it's a trip. The brain is such a trip. Like, when I tell people about EMDR, I always describe it as it's a trip.
Yeah.
Because where the brain goes, what it links to, the things that come up, and you're like, whoa. That's when you really realize how much unresolved stuff you have, is when you're doing EMDR and those kind of things come up, and you're like, what the hell? And it immediately
like,
makes you cry. You're like, that fucking hurts, and that happened when I was 5, and I thought I didn't even care. You know, but then it's just a few of these. And it's like, you know what, I don't care anymore. And it's true, though. You really don't.
These.
It's really,
a few of those.
All right.
Yeah. Okay, well, we're running out of time, but Jamie, I want to thank you so
Dude.
much for being here today.
Anytime.
You know that I just love you, and I'm just so excited to have had you here today, and we're definitely going to have to bring you on again.
Yeah, it's nice to
Anytime.
meet you.
Yeah.
It is so nice to meet you.
Yeah, thank you.
Yeah,
I
I'm
hope
glad
you guys
made
will
it.
see each other again.
I think we shall.
I'm so funny, huh? Justin, we're so glad that you
Yeah.
made it. We
Right.
missed you so much on the first episode, and we're so glad that you at least made it for half of this one.
Yeah, thanks for letting me pop in halfway.
Yeah.
Poof.
Well, we love you,
Magic.
and we want you to be here.
Studio
Yeah.
magic.
You're valued, you're important,
Oh, thank you.
and you're handsome, so you
I was
make
gonna say,
the
it's not
screen
bad
look
looking.
good. I know,
Thanks.
right?
Right.
He's easy on the eyes, thank God, because ugly people are rough. So,
Some
and I'm a
hate.
therapist. Can you believe that?
Ugly people in general.
You know what, though? I
Everybody's
love
beautiful.
all people. All people
Yeah.
are beautiful, and I
Everybody's
fight for
beautiful.
lives every single day, and so everybody knows that I'm joking. And if you don't, then don't fucking watch my show.
Then you
So-
are messed up.
Right? Because, I'm at that place in my life, too, where if you don't like me, just stay away from me. So, but I want to thank you for being here. And Justin and I, we will be back with you on the next episode
That's right.
of Therapeutic
Maybe.
Madness. If Justin can make it, he'll be here, too. He'll be here, or we'll
I'll
kill
be here.
him, or we'll freaking kill him. So, thank you for joining us. We'll see you on the next episode of Therapeutic Madness, and stay mad, my friends.
Play with